Hi, Thomas. I won't be using your Salifort enema because I find 30 mils is less effective.
Right. Dr. Eugene, if I understand you correctly, you seem to feel that 30 mils is not sufficient volume for left-sided colitis. Is that right?
Okay, so I would I'm thinking two things now here, Thomas. I'm not too sure whether you are leading the customer in this sense, because the customer didn't say what type of patients he's dealing with that he feels is not effective. So you probably could have asked, what do you mean, doctor, that it is insufficient? Does it mean insufficient means that it is not effective, or does it mean something else? Right. So you could try that, but on the other hand, you could also be right, Thomas. So I'm not too sure whether this is leading or whether it is okay or not. If you have tried it in the field and you get a good response, then that's fine. Huh?
Yes.
Are you concerned that the insufficient volume would translate to perhaps poorer patient outcomes?
All right. So you are once again. This is what you would also call, probably is not questioning the objection, but still trying to rephrase, trying to get an idea about what exactly his issues are. Good.
Sorry, come again. Sorry.
Is your concern with regards to the lesser volume that would translate to poorer patient outcomes?
Yes.
Right. I've encountered a similar situation with some of your peers in the past.
Okay. So, Thomas, before you jump into the similar situation story, try to do a recap of the clinical benefits of the clinical documentation on Cellophog. So where you can say that, first of all, 30 ml, although the volume is small, but the concentration is higher. So it has got more active compound than your competitors. Point number two, you could possibly also show that, and therefore after you show that, that data, you can ask, um, isn't that correct, doctor? Or wouldn't you agree that is correct, doctor? Number two, you can say, okay, what are the benefits of 30 ml, less volume and stuff like that? No backflow, for example. So you could bring that up and say, okay, no backflow means it's more comfortable for the patient, better compliance. Isn't that what you want for your patients, doctor? Higher compliance, meaning that they will heal faster, or the treatment will show the efficacy that's supposed to show. That a reduction of the symptoms. So do it that way, Thomas, before you go and show your similar situation story.
That they feel that the 30 mils may not be sufficient to cover left-sided colitis. But upon better understanding that efficacy is dose dependent, and also realizing that our sulfur enema comes in 2 grams over 30 mils, as opposed to the current other offering in the market that comes in 1 grams of 100 mils, sulfur enema offers higher concentration.
Okay, good. So Thomas, I was presumptuous earlier. So it looks like you are actually showing the clinical documents, the clinical data for the product. So that's good. So convert it into benefits and check in with the customer, whether he or she agrees that, yep, those are benefits that he wants. Otherwise, you would be talking too much or too long without an interaction from the customer side.
Hence, after knowing so, they were quite comfortable and felt that sulfur enema is naturally the better option for their patients. On top of that, most of them like our applicator as well. It is
So it looks like you are actually using the similar situation as a case study, where you are throwing in the clinical information as well. Yeah, that could work, Thomas. Or you could also, while you are relating the story, take out the clinical paper and just show it to them where it is in clinical paper, and then continue with the story. Yep.
soft and flexible, and it's pre-lubricated for patient comfort. And also, it has a backflow valve, stopping any backflow from happening. So does that address your concern about volume, Dr. Eugene?
Yeah. So you mentioned some nice things, some benefits, and all. Actually, features. So convert that into like for example, the backflow issue. So you got this valve that stops backflow, which means um, it stops the yuck factor, so the patients don't feel yucky, and when something is dripping down their legs and feel disgusted. Paint this kind of picture, Thomas, so that the customer is totally disgusted with your competitor's product. Okay, so do that, and of course the benefits. Keep going with the benefits. So less better compliance means they will keep taking as they are expected to take, and they can take anytime, so that they don't feel that, oh, I got to time the usage of Cellophog so that I don't use it just before I go to work, because I'm scared that it may backflow and soil my clothes and stuff like that. Yeah.
Oh yes, Thomas, it does.
So Dr. Eugene, would you like to proceed for your first order, an order of 10 boxes, or you prefer 30 boxes instead?
I'll go with 30 boxes, Thomas.
Okay, good, Thomas. So you checked in with the customer whether concerns have been addressed, and you immediately went into the close. Good framing of the close as well.
Great, thanks. I'll put an order for you, Dr. Eugene. Thanks.
I don't want to use Cellophog anymore because the amount is not enough for the patients.
Oh, Dr. Renita, your concern is because our Renita enema is have only 30 ml.
All right, very good rephrasing, Bina.
Which you feel that is not enough?
That's right. That's right.
Then doctor, then how much the amount that doctor feel that if how much amount of the enema that doctor you feel that appropriate for patient to use?
Okay, that's an interesting way of questioning the objection. Okay.
I can't hear.
How much the amount that doctor feel that is enough for your patient to use?
I feel it should be more than that.
Okay, so before we go any further, Bina, this approach was a good one, and the customer is not really sure how much also. If it was a real doctor, he or she really doesn't know how much should be more, or maybe they'll give some volume that they feel is the right amount. You could also have asked the customer, what makes you say that 30 ml is insufficient? What's the reason why they say it's insufficient? So that's another way to question your objection.
Doctor, why you say Cellophog enema the amount is 30 ml because it's only 2 grams, because it's so concentration. Furthermore, the technical of the
Okay, so as you are going through this, you are saying that Cellophog enema has got a higher concentration. I hope you are actually showing some kind of clinical documentation, the clinical paper or a graph or a chart, just to re-emphasize with the customer that clinically it has been proven.
administration of the enema is very important. That will be give a very effective to treat the root cause.
So I think couldn't hear you clearly here, Bina, but I guess you were trying to say the technique of inserting the enema is also very important. Yeah. So again, if you have some graphs or something like that, some pictures, that you can show, that would be helpful as well. Or if you have the clinical paper which says that that the technique is important, bring it up as well.
Doctor, do you think that then I will show doctor the James, then I will show doctor the technician, the technique, yeah?
All right, good. So I don't know how you're going to show, Bina, whether you're going to use a video or you're going to use, some charts, pictures and stuff like that. Yeah, so that's good, huh?
Doctor, do you think that this administration of technique will be show you a better understanding to use the enema, Cellophog?
Okay, so one of the earlier questions also, Bina, now that you mentioned all this, is when the doctor had, given the objection, after you have rephrased it, one of the questions you could ask about the objection is, you could have asked, could it be possible, doctor, that your patients are probably not using the right technique? The doctor may, in this instance, feel defensive and say, no, they know how to use. And then you could question the doctor once again and say, where did your patients learn how the proper technique of using the enema, doctor? So you could ask that. But it's a good question that you're asking here to check in with the customer whether the right technique that you have just demonstrated or shown would be helpful for the patients.
Enema.
Yes.
Doctor, do you wish to order 5 boxes or prefer 10 boxes to try for your patient first?
Okay, so do you wish to order 5 or do you prefer to order 10 boxes? Okay, so that's a good close.
Okay, I will take 5 boxes.
Thank you, doctor.
Kathy, I won't use HexBio because the CFU cell is not printed on the boxes.
Oh, if I understand you correctly, do you mean that the information written on the box is the concern stopping you from using it?
Okay, good one, Kathy. That's a nice way of rephrasing it.
Yes.
Yeah, can I know any other brand that you are printed on the packaging?
Okay, so yeah, that's a good way of questioning the objection actually, by asking, is there any other brand that has the CFUs printed? Okay.
Any brand in market?
Okay.
So the customer is saying, all the brands that he deals with has it printed.
For your information.
Lacto GG.
Okay. For your information, we do inform this issue to principal, and the latest news is that principal will print this information on the new packaging. Did I answer your concern well?
Okay, so before you do that, Kathy, maybe you want to tell a specific date or a month or something like that, just to reassure the customer. And then you can ask what you're just about to ask.
Yes.
Okay. So, Steve, can I send you 10 boxes or you prefer 20 boxes?
Okay, good. So can I send you 10 or do you prefer? Okay, that's a good close.
I prefer 20 boxes.
Okay, thanks.
Hi, Cecilia. I won't use your HexBio because it's expensive.
Hi, Woon. I understand your concern. Do you mean that the price is the concern stopping you from using HexBio?
All right, Cecilia, good way to rephrase.
Yes, this is my main concern.
Can I know HexBio is expensive compared to which other brand you are currently selling now?
Okay, good, Cecilia. Good way to question the objection. You could also ask, expensive. You said compared to what? You could also ask, what would you consider as not expensive? Okay, so you are turning it the other way around, upside down as well.
BioLife?
Oh, okay. To answer this, HexBio is actually not expensive if you calculate by sachet. Per sachet is only 2 ringgit 10 cents, which BioLife is 3 ringgit per sachet. The
Okay, so good. So you're comparing apple to apple. Very good.
price is much more affordable compared to BioLife.
Okay, so you could stop here and ask, don't you think that it is cheaper, Woon?
Oh, I see. Thanks for reminding me.
Oh, okay. So did I answer your concern well?
Yeah.
Okay, so Woon, can I send you 10 boxes or will you prefer 20 boxes?
I prefer 20 boxes.
Okay, good, Cecilia. So you immediately after you asked the customer whether the concern has been addressed, you went straight into the closing and you phrased it well as well. Good.
Thanks,
Okay.
Cecilia.
Thank you, Woon.
Usually, I feel the 30 ml enema is not sufficient for my patients with left-sided colitis.
Okay, so Dr. Thomas, let me get you correctly. You think that the Salifort enema's volume at 30 ml is less effective for left-sided colitis application. Am I?
Right. So good, Eugene. You have rephrased it and gone specifically on what you're guessing that doctor is talking about, that it is not effective.
All right.
Correct. Your competitor has a higher volume.
So Dr. Thomas, which competitor are you referring to?
Pentasa.
Good. You're identifying who that is.
Pentasa, they have the 100 mils volume for enema. Am I right?
Yes, and the rep is telling me that that would be sufficient enough to cover left-sided. More volume would be better to cover left-sided colitis.
Okay.
Okay. So here is a situation, Eugene, where you didn't have to question the objection and ask the doctor what makes him think that 30 ml is not sufficient, because he has given you the answer here itself, that this is what the competitor's rep has said, and created doubt about your product by pointing out that 100 ml is better than 30 ml, right? So now you know why he feels that 30 ml is insufficient.
So Dr. Thomas, let me share with you one experience from Hospital ABC. So
Okay, so this is where, Eugene, before you start your similar situation story, take out the clinical documents that you have, whether it's a clinical paper or the sales aid, and once again go through the information that shows that 30 ml, the clinical studies that show that 30 ml is effective in these kind of patients. That's all you need to show, and then get the agreement from the customer. If it is a large number of clinical studies, or if it is clinical studies with a lot of patients, then you got the power of the number of patients on your side. So you can say, well, doc, since it has worked in so many more patients, don't you think that clinically it is supposed to work and therefore benefit your patients? All right. So let him say yes, and then you can go into your similar situation story.
yeah, also using both Salifort enema and also Pentasa enema. What the feedback I
Okay, so this is a good story because you have a customer who is using both. So this is an interesting story, yeah, with direct comparison or direct outcomes.
got from that hospital is that they find patient tolerated well with Salifort enema because although Pentasa gives you 100 mils or more volume compared to Salifort enema, they find that there is a lot of dripping or backflow from the Pentasa enema compared to Salifort enema, which in fact they say is less effective compare if you were to compare between both Salifort enema and Pentasa enema.
So Eugene, a couple of things that you're bringing up here. Now, one is that backflow, and then also you're talking about efficacy. Yeah. So let's take the backflow first. So in this case, you may want to get the doctor's mind to be quite creative, and just tell the doctor. Imagine, doctor, all these patients who are using Pentasa, there's backflow. Can you imagine how uncomfortable it could feel for the patients? Let the doctor feel that discomfort as well. And this is probably the only time I would encourage you to ask a question where the doctor is going to say no. Therefore, what I'm trying to say is you can ask, um, Doc, would you want your patients to go through this? And he's probably going to say, no, I don't want my patients to go through this. Okay. So this is the only time I would really encourage you to get the doctor to say no while you are discussing a product. Because this no, when he says, is going to make his mind block out Pentasa and look at Salofolk favorably. Now, the second thing you're mentioning here is that they find that it is more effective. So it's good if you can tell the doctor, how do they know it is more effective? Salofolk versus Pentasa. What kind of measure did they have to show that it is more effective with Salofolk?
And for your information, Salifort enema is, although it is 30 mils, but it is of higher concentration at 2 grams, and it is thicker. So it actually coats the inner lining of the colon well.
Okay, so you're introducing a couple of new points here as well. One I haven't heard yet, which is the higher viscosity, higher concentration. Yep, I've heard from quite a number of reps, so that's good. Again, um, use some kind of audio visual, whether it's clinical paper or some sales aid with some beautiful colorful charts and graphs and stuff like that. And there's a comparison chart, Eugene, between Salofolk and Pentasa in terms of the concentration. Great, show that as well, so that it is seared in Thomas's mind. And the viscosity is also good, because then you are explaining why, probably besides the backflow valve, the reason why there is also less backflow, because the solution itself is higher viscosity, so it doesn't flow back that easily.
compared to a more watery suspension of Pentasa enema. So if let's say you were to choose, with this explanation, do you think sulfur enema will actually help you with your left-sided colitis better?
From your explanation, it does seem so lah.
Okay, so the customer seems to have a little bit of doubt there as well, because he said seems so, huh? Or maybe not, huh? Maybe that's the way he speaks as well. Good. So you are getting the confirmation from the customer whether whatever you have presented is making sense for him.
Okay. So if I have addressed this concern of yours, would you like to try on sulfur enema maybe at the standard package of 10, or would you like to go for the bonus packaging of 30 plus 5?
I think
All right. So you could do it the way you have done, Eugene, which is good. Or you could also throw in the word prefer somewhere inside there towards the end. Or would you prefer the bonus? You could phrase it that way as well. Yeah. And by the way, the bonus is also a power word, because the human mind likes free, likes the word bonus, discounts, all these kind of terminologies.
I'll go with 10 first for a start. Thanks, Eugene.
All right. Thank
Good, Eugene.
you, Dr. Thomas.
Hey, Felix, your enema is quite expensive lah, and then I think it's not in the tender.
Yeah, it's not in tender.
Okay, so Felix, you are starting off by acknowledging that it is not in the tender. Let's see what else you're going to say.
Also on the pricing, you mentioned that you find it too expensive?
Yeah, I find it's a bit expensive lah.
Okay.
All right, so yep, it's a very simple rephrase. Just throwing it back and saying you're saying it's expensive. Okay. Now regarding the tender, I think there's nothing you can do about it. You're just saying, you're saying it's not in the tender. Okay, that's another rephrase as well.
Doctor, just curiously, did the patient mention that the pricing is unaffordable, or is it too expensive for them? Did they mention anything like that?
No, they never mentioned.
Okay, so good question you're asking, whether the patient actually mentioned it.
Because I prescribe and then I ask them to go to the pharmacy, but I personally believe that the price is quite higher compared to the one that I'm using. Yeah.
I understand the situation. So actually it's like this, I see your concern. We do get feedback from other doctors that the pricing is a bit on the high side.
Okay, so Felix, first of all, never ever admit that that some other customer has said that it is expensive. Okay, you don't need to say all these kind of things, because expensive, the word expensive is a negative word. So remember, during the training we learned don't use negative words. So avoid all kinds of negative words. So he doesn't need to know if people have mentioned this to you. You just need to tackle the objection. So one way. Another question of the objection that he's mentioning now is, to ask, what does he mean by expensive? What kind of price does he think ought to be a reasonable price, a non-expensive price? Let him say whatever he needs to say. Let him vent out, his frustrations or stuff like that. And a third way to challenge that objection is, doctor, those patients who you have, written a prescription to buy from outside, how many of them have come back and told you that it's expensive? I presume it's no one, because he said that nobody, right? So a better way to do this is to ask, so how many of these patients, doctor, has come back to you for a new prescription? And if he gives a number, whatever the number is, you can say, how many % of those that you put on is that, doctor, that you put on Salofol? Is it 100%? It is 90%, 80%? Let him think about it. Because that's the way you're challenging his objection. Because for all you know, if 100% of the people have come back to this doctor and asked him for a refill or a new prescription, then it confirms that price is not an issue.
However, we also do have users where their patients find that our cellular edema is ergonomic, the applicator is ergonomic, comfortable, and they find it prevents black flow. That I believe will translate to more compliance also and ensuring effective medication.
Okay, so what you are doing here, Felix, is if you are talking about backflow and then compliance, so what you're trying to say, doc, because that it is 30 ml, there's low backflow, which also means that the patients will feel more comfortable because nothing is dripping down their thighs and stuff like that. Wouldn't that be a benefit for your patients, doctor? So once again, just like in the first part, where we learned about always getting the doctor to agree with your benefits, even when you're handling objections, do the same also. So every time you mention a benefit, ask the doctor, isn't there a benefit that your patients are looking for?
Since it doesn't cause backflow. So what do you think about the benefits?
Yeah, so you're grouping all the benefits now and asking him. So it's going to be difficult for the doctor now to figure out which benefits you're referring to. And most probably he's going to be just focused on the last one you say. So in his mind, it may eventually, after you leave, he may just think about it and say, hey, there was only one benefit that Felix actually discussed with me, which is the backflow, not the other one. So that's why you should, after each benefit, stop and say, isn't that a benefit that you want for your patients? Or isn't that a benefit that you would find convenient for you or for the hospital or whatever other party that's involved?
Sounds interesting.
Yeah. Doctor, I do believe you probably could see the advantages. Perhaps you could have a...
Okay, so Felix, I'm going to stop you now. You probably missed that signal there. The word that you use, it's interesting, is actually a buying signal. So you could have immediately here gone in for the close.
Of how getting 10 plus 1, or would you prefer a better promo of 20 plus 3?
Okay, so you have done it, right? Okay, that's good.
I'll get the promo 20 plus 3.
Okay. Thanks, doctor.
I won't use HIO because it is powder form.
Hi, Miling. You won't use Hexfire because it's in powder form?
Yes.
Is there any feedback from your patient that don't like powder form of probiotics?
Okay, so Jess, your rephrase was good, and the second step after the rephrase is supposed to question the customer about the objection. So instead of asking, a leading question like this, what you should ask is why she doesn't like to use powder form. So get it from her instead of leading her.
Actually, it's good if the probiotics in a powder form.
Okay, so now you are going into the discussion or answering the objection. And I hope that when you are doing this in real life, you are using a clinical paper or some kind of sales aid or charts and stuff like that to convince the customer once again. You may have done this before, but always remember, always use your audio-visual aids, because when it's audio-visual, the brain remembers it better and is able to recall it better as well.
It can be easily to absorb and will be more effective, especially for the diarrhea patients.
So here is also another opportunity for you, Jazz, after you have revealed this information, to once again ask the pharmacist, how many diarrhea patients do you have? Or you can ask, aren't most of your customers who come, who request for probiotic or that you are recommending probiotics for, have diarrhea situations? And get her to say yes. So when she says yes, then it's easier for you to convince her and say, look, according to the clinical studies, it shows that it is better for your patients.
Meaning, do you agree with me?
Yep, it's good that you asked her to agree with you.
Yes.
So do you want me to send you 20 sets or 50 sets?
20.
All right, Jess, good. So you went into the close, but remember to always use the word, or better to use the word prefer. So do you want me to send you this, or do you prefer the higher quantity, 50, right? Okay.
Okay.
Jed, actually, this Salaford enema, the volume is too low. That's why it's not effective on the patient who have this left side of the colitis.
Oh, I see, doctor. So, doctor, you are saying that you are not using the sulfide enema because the volume is too low and you found it's not effective for the left side ulcerative colitis.
Yeah, I find.
Good, good move, Jet. That's exactly the way you are supposed to do rephrasing of the objection, right?
Oh, there, yes, that's right.
I see, I see. So, doctor, you actually, I do have another doctor from another hospital.
All right. So before you I know you're trying to share a similar situation story here. Before you do that, you need to check with the customer how often, how many patients of his have had this situation where Saloforg has not been effective. And so that's one question. Huh? So how many patients? Number two, what does he mean by not effective? What is he using to measure whether it is working or not working, right? So if you know that, as well as how many patients in total he is using Saloforg for ulcerative colitis, then you can really see, okay, is it a very small number or is it a large number? All right, for all you know, it could be just 2-3 people out of 300 that he has used, so it becomes very insignificant. Yep.
Do feedback the quite similar thing lah. But what after that they try us some of the sample, and he noticed that actually although our volume at sulfide enema volumes is low, but it's still more effective than our competitor because our dosage is higher.
All right, so Jet, I'm going to stop here now and just point out to you. So I am guessing that what you're trying to say here is not low dosage, or rather high dosage. What you're trying to say is high concentration, right? Because 30 ml is one dose, so that's a small volume, but the concentration of the active compound in Saloforg is high, or higher than the competitor, which is what you're bringing up here. So, and before you go into the similar situation story, Jet, what you should also do is take out the clinical paper or take out the sales aid and show the customer once again, Doc, 30 ml of Saloforg has this much concentration of the active compound, and that is a higher concentration per ml compared to the competitor. Right, so you're saying it's a higher concentration, and according to the clinical studies, it works because of this. Then you jump in with your similar situation story, and your impact is far higher. Okay, Jack?
So after that, what he do is like he switched from our competitor to our products because his fight is more effective because of the higher dose.
So good similar situation story, very relevant to the case, Jack.
I see. All right.
So doctor, did I answer your concern?
Yeah, okay. I don't mind to try.
So that was a great buying signal, huh, Jet?
I see. So doctor, for the start, do you want to?
So Jet, I know what you're going to say. So before, when the customer gives this kind of buying signals, he said that he's willing to try. Your response was, I see. Okay, so that's kind of a neutral response. What you should do is throw in more powerful or encouraging responses, like, that's great to hear, doctor, or I'm glad that you're willing to try, and then you go into the closing, which you're about to do here.
Go for like 10 boxes, or do you prefer like 30 boxes?
No, like just send me 5 will do.
Okay, good. Jet, I like the way you closed, where you use the word prefer just before the larger quantity. All right, good one.
Try first.
Can. Thanks, Dr. John. Hi, John. I don't use Salofox tablets because my patient cannot tolerate. Got a lot of side effects.
Okay, I see. Dr. Jack, thanks. So are you trying to say that the Saloforg will cause the side effect of the gastro disturbances compared to Pentasa? Well, doctor,
So what you could have done here better would be to have just waited for the doctor to acknowledge, because you're asking a question. So just wait for him to say, yes, that is what I mean. Then you can carry on.
Actually, these are the clinical studies shown that actually the side effect actually is very minimum or hardly has the side effect.
So John, the other thing also, so after you have gotten the acknowledgement from the customer, just question the objection, meaning you got to ask them, how many of your patients have had, side effects or poor tolerability? And second question you should also ask is, what type of side effects are they having? Are the patients having? So from this, you can see whether it is very common in his practice or not so common. And therefore, you need to also ask the customer, how many patients have he used the product on, Salofolk on. So if you know the data, good. Then you can, use the side effect, number of side effects versus the overall number of patients that he has. And for all you know, it'll be a very small amount. And then you can go into the discussion about the data on the side effects.
I was told by this Dr. ABC from this hospital XYZ. She was telling me that his patients are all well tolerated with Salofolk 500 tablet, and according to his prescription, prescribing dosage. So did I answer your?
Okay, so before we go into that, John, so I am presuming that when you are talking about or you're telling the customer that clinical studies have shown that it is a low level of side effects, you are pulling out a clinical paper or the sales aid with the appropriate graph or chart to show the customer, because nothing beats audio visual. The retention is much better, as well as the recall in the future. So, yep, it's a good story, by the way, a good similar situation story that you have shared.
Concern, doctor, at this point of time? If
yes.
Yeah, thank you very much, Dr. Jack. And can I send you 5 boxes, or you prefer 10 boxes for the start?
I prefer 10 boxes, John.
Okay, all right. So that was good, John. Your closing is also good. You used the word prefer there, all right? So that was good.
Thanks, Dr. Jack.
Hi, Lester. I find that your Salofolk enema is not enough for the left-sided colitis.
Oh, so doctor, you were saying that 30 ml of Salofolk enema is not sufficient to treat your patient with left-sided colitis. Am I right to say that, doctor?
Very, very precise, Lester. Very good, because the doctor didn't exactly say that, but you are saying, do you mean that it is this, that it is insufficient for this type of patients?
All right. So
30 ml I think is little too little.
May I know what makes you think 30 ml is not sufficient? Are you using any of enema for your left-sided colitis at the moment?
Okay, so you're asking two questions back to back, Lester. So you can break it up. Ask one question first, see what he answers, and then you can ask the second question.
Your patient?
Yeah, I'm using the Pentasal one, which I find is more.
Oh, so you're...
So you see what has happened here, Lester, because you asked two questions back to back, he forgot to answer the first question, right? So that's why we normally would not ask two questions in a row, because the human mind will forget the first one and just focus on the second one.
Using Pentasa, which is the 100 ml, am I right?
Yes, I know.
I see. Well, in fact, doctor, one of the key center in KK, which is...
Okay, so Lester, you are going straight into the similar situation story. It would be better if you could whip out a clinical paper or the sales aid, a graph or a chart, which proves that 30 ml works or is effective even for these type of ulcerative patients. Okay, so show the clinical proof first, the documentation, and then you can jump into your similar situation story.
Hospital Queen Elizabeth is one of our user that use Salofolk enema a lot. So why? Because they believe that Salofolk enema in low volume, it able to retain the liquid in the colon.
So you are now sharing. I don't know whether this is information which can be found in a clinical study or not. If it exists in clinical studies, show that, and then back it up with what you're just saying. If it doesn't, then great. Then this is showing something which is outside of the clinical studies, because sometimes clinical studies don't pick up certain things, like the techniques to use and stuff like that. So that's a great point that you're bringing up here.
So it also helps to prevent backflow, and also easy to squeeze, easy to empty compared to the 100 ml. As you're aware that even though you are prescribing 100 ml, there might be backflow, and then it will cause discomfort to the patient lah.
So Lester, this what you just described is is what we call a yucky factor or yuck factor. So if you can really make it even worse by saying, imagine doctor, a patient who uses that 100 ml, he puts on his pants, or if it's a lady, wears their dress, and then they walk out and then they find that it is dripping down their thigh, and it makes them very uncomfortable. So that is being very graphical. So the human mind will actually picture that and feel disgusted. So when when that human mind sees that horrible image, they are actually saying, yuck, Pentasa is not that great. Okay.
So what do you think about these features, doctor?
Yeah, sounds great. Perhaps I should try it.
So, doctor, can I send you 5 boxes, or do you prefer 20 boxes?
Yeah, I think I'll go for 20 boxes.
Okay, good one, Lester. That's a good closing. Very good.
All right, thank you. Okay.
Yeah, I won't use X-Bio because it's in powder form.
If I understand you correctly, do you mean that the form of H-Bio is the concern stopping you from using it?
All right, Mili, your rephrase is good because you used the word, do you mean, if I understand you correctly? Or say, okay, so that's a very good phrase to use, if I understand you correctly.
Yes.
Can I know any other probiotic are you selling now?
Okay, so Mili, definitely this is not the first time you are seeing this customer, because this customer probably has bought, or you have seen this customer a few times before, or maybe, so if you have seen this customer before, then you should already know, before you actually talk about your product, remember in the need identification steps, you are already asking them, what are you using now? So you should already have this answer with you. So there's no need for you to ask this question.
I got 20 customer feedback to me. Okay, even H-Bio is in powder form, its wound effect is effectiveness compared to tablet form.
Okay, so Mili, you are jumping straight into the similar situation story. It is good if you can show proof that the powder form works. So use a clinical paper, use some kind of chart or graphs and all that you have to show the proof. And then you can go into your similar situation story.
Did I answer your concern well? Is
Yes.
information benefit to your customer?
Yes.
So, Jess, can I send you 5 boxes, or you prefer 10 boxes?
So you just send 10. Let me try.
Okay, good, Milik. So your close was good. You waited for the customer to confirm that the concern has been handled, and you jump straight away into the close. Okay, good.
Okay, thanks.
You can start.
Renita, I don't feel that I would want to use your Salofort because it's I feel my patient have a lot of side effect.
I see. So you have some patients experiencing side effect, doctor?
Okay, so Renita, what you are doing here is you are leading the customer to answer the question. So first of all, you need to rephrase. So the rephrase part is missing, and you are jumping straight into the questioning of the objection. So rephrase first. And just to confirm, okay, is this what is your problem, that you are not going to use Sulfok because you have patients who got side effects. So what you're doing here is the second part, which is to question the objection, and therefore you're trying to find out how many patients of yours have got this side effect. That's the first question. For all you know, it could be a very small number. So ask that question rather than saying some of your patients have got the side effect. So push them or get them to answer that question. Secondly, what type of side effects are we talking about? Right. So these are the two questions you should ask to question the objection.
Yes.
What type of side effects?
All right, good. So you asked that, good.
They feel like bloating, gastric, discomfort.
Okay, I understand your concern, doctor. I would like to share that Professor Ida from PPUM has shared with us that her patients on...
Okay, Renita, I'm going to stop you now. I know you're trying to share a similar situation story. It will be also good at this stage to, before you share the story, to once again show proof that Sulfok works. So pull out a clinical paper or turn to the appropriate page on your sales aid and show the chart, show the graph, whatever you need to show to prove that the evidence exists. So clinically it exists. And then you jump into the similar situation to show, okay, so I showed you the clinical study, now real life, this is what this customer has shared with you, the success story of Sulfok.
Sulfok has lesser discomfort and she doesn't have to keep monitoring the patients for any side effects as compared to our competitors. Also,
so as you can see here, Renda, there are a couple of points you're bringing up here while you're sharing the story. One is don't need to monitor the patient. So you could stop there and ask, doctor, wouldn't it be good for you if you don't have to monitor your patients that frequently? And then when she says yes, then you continue with your similar situation story.
She found that those patients on our Sulfok tablets, she can easily switch them between grams for better tolerance. She's unable to do that with Pentasa.
Okay, so as you just pointed out, that second point there, that you can switch brands, this is where you can once again ask the customer, don't you find, doctor, that very often there is insufficient stock or stockouts of your most popular brand? And if it is true that this is normally happening, then they will be saying yes, and then you can confirm once again the story that you're sharing.
It shows higher rejection and the remission rate is also way higher. Does that answer your concern, doctor?
Yes.
So good. You checked in with the customer to see if they accept the way you have addressed the objection.
Okay, doctor. How about I send you 10 boxes of Sulfok tablets, or would you prefer 20 boxes?
Okay, wonderful, Renita. Your closing was great because you used an open question there. How about I send you this, or do you prefer the higher quantity? Okay, so that's good. It's totally open, huh?
I will start with the low amount first.
Roland, so the reason that I'm not using Hexbio is because I feel that higher CFU count is more beneficial to my patients compared to the lower CFU count.
Oh, yeah, Sharon, I understand your concern, but any of your...
Roland, that was good. I understand your concern. Yep, that was nice.
The other brands actually prove to you that they show you any studies to show that higher CFU counts actually provide more benefits?
Okay, so before you go into that, Roland, what you have missed out here is that you could have rephrased the objection that Sharon, if I hear you correctly, you are saying that low CFU is not effective because you were saying higher is better, right? So you are reversing it and you're saying that what you're saying is that lower CFU is not beneficial, not effective. and check in with her, and she will probably say yes. Then the next question is, you could ask, what makes you say that? What makes you say that higher CFU is better? And then let's see what she has to say. And then you can probably even ask what you're about to ask now.
As compared to a lower CFU?
So you're saying that whether my other brands got any studies or not, is
Yeah,
it?
did they show you any proof to show that, or it's just, based on verbal, just telling you bigger is better, more is better?
Actually, they only tell me lah that more is better lah.
Yeah.
So that was good. That was a good challenge, Roland. So now you can see that the customer is telling you, well, this is what they are saying. All right.
But if I can actually show you clinically proven study now to show that HexBio actually provides a wide range of benefits ranging from patients young to old and many with complicated risk diseases, and to show that it has been statistically and clinically proven as well, would you choose HexBio today?
Okay, that was a good technique, Roland. If I were to show you that you're trying to get some kind of commitment from the customer here, if I were to show you that such benefits exist, would you choose HexBio? Okay, so that's a nice touch as well.
Well, a product which is based on hearsay.
If you can prove to me, then why not? I don't mind to give it a try.
Right. So your answer would be yes, right?
Yes.
So I
That's a great way of getting the customer to say yes, Roland.
provide you all the study that I have. So have I addressed your concern that a higher CFU actually provides better benefit to your patients?
Yes, you did.
Yeah. So since you agreed with me, so can I send you?
So Roland, instead of saying since you agree with me, because it's not really agreeing with you per se, but with your your proof. And since this is not proof that we ourselves created, so you can just say, well, since you agree, you can just leave it at that. Or since you agree with the benefits that have been shown, then you can go into your close as you're going to do now.
Your usual 10 boxes, or instead would you prefer 100 so that you can share more of this benefit to your customers?
Okay, Roland. So a better way to rephrase the close would be, should I send you this quantity, or would you prefer the higher quantity?
Can I give me 100 lah?
Not 200, huh?
No.
Well, Sharon, I find that HexBio is more expensive compared to the other brands.
Okay, I hear you, Roland. So what you are saying is that you have patients coming in and telling you that they don't want HexBio because it is expensive. Am I correct?
That's right.
All right, good, very good method of rephrasing. Yep, if I hear you correct, great. And you waited for the customer to acknowledge it, and the customer is acknowledged.
That's right. That's right.
Okay, so I understand that price is a cause of concern for most of the customers, or I would say patients. But think of it this way: something good might not be cheap, right? Most of things outside there, good things are not cheap.
Okay, that's a good one, Sharon. I'm glad that you use this. A lot of people forget to use this, so it's a good point, right?
Cheap things are not good, So with that said, other than that, what HexBio can give to your patients is that with the pandemic now that's ongoing, right? Everybody is worried. So what we need to do is to boost our immune system. Okay, a lot of
So Sharon, I hope that when you are talking about these kind of details, data about immunity being boosted, I hope that there is something that you can show the customer that with HexBio, it affects the immunity positively. All right. So if you have that, then that is great. Some kind of clinical paper or some kind of chart or something like that. Even if it is not specifically HexBio related. I don't know if they have done any clinical studies because they're pretty expensive. But and being a Malaysian company, it may be beyond their scope or ability to do something like that. But if it exists, show that. Yeah.
Half of us are not aware that actually gut does produce to help to boost our immunity as well. So with that said, we need to protect our gut. So what HexBio can do for your patients is that it helps to regulate their bowel system if they face diarrhea or if they have constipation. Yeah, you can use HexBio. On top of that.
Okay, so Sharon, you are sharing now which type of patients would benefit from it. So this is where you can basically stop and check in with the customer and say, first of all, you could ask, wouldn't that be something that your diarrhea patients would find beneficial, right? Second thing, you could probably also, once again, if you have forgotten or this is the first time you're seeing this customer, you could ask, how many diarrhea patients do you normally see, in a week or in a month? So you got some hard numbers now, huh?
HexBio can be taken by children as young as 1 year old.
All right. So here again, Sharon, you can stop here and say, wouldn't that be also great, Mr. Pharmacist, Roland, that, with just one product that you are stocking, you can have a beneficial effect for elderly, for young adults, and even for young children from 1 year of age. So one product has got a huge spectrum, a wide spectrum of people that it can work on or work with.
So what do you think? Can start them young,
Good. I'm glad that you stopped here and checked in and asked the customer what he or she feels.
Yeah. So do I answer your question, Roland?
Yeah, you did actually. Yeah.
Yeah. So since you have agreed with me, so
Sharon, so instead of saying since you agree with me, it's like, instead of saying agree with me, it's better to say I'm glad to hear that you agree with these findings, because it is not our findings. If we were the guy or the girl who created this product and all, then we can say, yeah, I'm glad you agree with me, because it's not really our data. It's somebody else's data that we're using. So we can just leave it as, well, I'm glad that you agree with what has been mentioned so far, or you agree with all these facts, you agree with all these benefits. Okay.
How about I send you 50 boxes, or would you prefer 100 actually?
In that case, send me 200 lah.
All right. So, I like the way you closed, because you kept it really open by asking, how about, how about I send you this much, or would you prefer another a higher quantity? Okay, good one.
Oh, very good. Thank you very much.
Hey, Steve, I won't use HexBio because it's expensive than other brand.
Hi, Katie. Is there any complaint about the pricing issue?
Okay, so you are actually questioning the objection, Steve. So before you do this, better to ask the customer to rephrase the objection. Dr. Kathy, you are saying that the product is expensive. Is that correct? So get them to say. Then you question the objection. So when you question the objection, you should. There are a couple of ways you can do this. First, you can ask, how many patients actually say it's expensive? And or you could also ask, when you say it's expensive, compared to what? Right?
Yeah, my customer complained that the price they are bought at other pharmacies that are lower than I'm selling the price.
Okay, so this now raises another thing. So let me see how you're handling this, Steve.
Oh, is there any competitor pricing is cheaper than us?
Okay, so before you ask that, I am not too sure whether what Kathy says is that when people buy from other pharmacies, is it another brand, or is it HexBio that the other pharmacy is selling cheaper? Because if it's HexBio that another pharmacy is selling cheaper, then the issue was on their side actually. And your question is also a good question here, where you're challenging. Are there other probiotics which are selling cheaper than HexBio? Good. Let's see what she says.
Is that one of the issue also?
Yeah, other brand yes. Like BioLife, they almost always promotion. Yeah.
I see, I see. Okay, Kathy, actually one of my customer in Pahang.
Okay, so before you go into your similar situation, you should be checking in with Kathy and asking what exactly is BioLife's price when they have the promotion, and what do they mean always having promotion. I don't think any company will be having always a promotion. Huh? At the most, it will probably be every quarter. Can't be every month, can't be every week or every day. So it's good for you to find out what exactly the price levels are.
Also telling me the same thing lah. He mentioned our Hex Bio is expensive too. So what I mentioned to him that as what you can see, competitor is cheaper, but please have a look at the CFU count. It is only 3 billion, but with Hex Bio, it is 30 billion.
Very good point, Steve.
Beside that, with just a difference of RM1, you can offer your patient with something better.
Okay, so you are saying that you have a higher CFU. What you can do here, Steve, is stop here now and ask the customer, don't you agree that the higher CFU is better for your patients? All right?
So, Kathy, did I answer your concern? Is this benefit to your customer?
And the other point you're mentioning also is that for a slightly higher price, you are getting what, 10 times more CFU. One is 3 million, whereas XBio is 30. One is 3 billion, yours is 30 billion. So 10 times more just for a small price difference. Okay. And this is where, Steve, you could possibly also, if you want to be very mathematical, you can do this. Okay. Just take the 3 billion. What you could do is take the price of the competitor and divide by the 3 billion, and then you can show how much per billion it is, and then you take your price and divide by the 30 billion and show the customer, hey, for each billion of Hex Bio, it is cheaper than the competitors. All right, so you are turning it the other way around. An expensive thing now suddenly becomes or looks cheap already, or economical.
Yes.
So, Kathy, would you like to try our Hex Bio? How about 10 plus 1? Or you prefer 20 plus 3?
All right, good, Steve. You made a mistake there and you recovered very fast. Would you like to buy? So initially you said, would you like to buy? And then you changed it very quickly into the proper format for the closing, okay, which was good. So good thinking on your feet there.
Okay, I order 20 plus 3 lah.
Okay, thanks.
Good, all right.
Yeah.
Hi, Woon. I think I won't use Hex Bio lah because Hex Bio is in powder form.
Oh, okay. Can I understand your correctly? Do you mean the powder form is your concern?
Yep, okay, good one. Good way to rephrase it.
Yes, it's the concern that is the thing that I concern now for this probiotic.
Okay, I also understand you have selling.
Okay, so Woon, you could follow up that, because when she says that it is a concern, you could ask, what is the concern actually?
Tablet form. So although it is the powder form, although Hex Bio is a powder form, it may give your patient another option. By the way, it also work very well, which is my regular customer also recommend to their all diarrhea patient. Did I?
All right. So, Woon, you are going into the similar situation story. Before that, Woon, you may you see that we don't have enough information about what her concern is. Maybe she feels that the powder is not effective. So, whatever her real concern is, you can address it with a clinical paper or with a chart or a graph from your sales aid. Okay. So, show them the proof, and then you can talk about or go into your similar situation story.
Provide you an answer?
Yes, you answer my concern well.
Okay, thank you. How can I send you a 10 box or you prefer 20 boxes?
I will try a 20 boxes first.
Okay, so Woon, good. The closing is good. You confirm first whether the concern has been addressed, and then you jump straight away into the closing statement. Very good.
This time.
Okay, thank you.